everyone. Welcome to again the channel. We are going to discuss about examples of practical life situations. Practical life situation. Mostly when it comes to emergencies. Sometimes you can be walking around. You just walk around, and then you find people are together panicking because maybe someone is unconscious, and you are there wondering what you can do. Or you just get to your home, you find someone is totally sick, and speaking out is a problem. There are some people who panic or take wrong moves when it comes to these situations. Now we're gonna see the the approach, how someone can approach these situations in a real life situation. Get it? When you get to an emergency and you are not a doctor, you have no medical uh, education uh, about emergency training, or how to work on someone when this person is unresponsive. There are some things that you need to follow up to help, because sometimes you may help and things turn up to be worse. You see this, you may help and things turn up to be tragic. Like if you go to an accident and then you find you're trying to help someone who is bleeding and unresponsive, you may make this person to be more disabled. Most of people I know you've had, like paraplegias. Paraplegias are those people who cannot move, and they are always on wheelchairs because maybe of damage of accidents. Most of those situations they come at the site of accident because of how you retrieve them from the accident, and then you end up damaging this person's nervous system. It is important to get to a situation. It's important when you get to a situation and you don't know what is happening. You how to manage your moves, very important. How to manage yourself is very important. Panicking is a very bad thing when you come to approach on emergencies, because you may not think straight. You take a deep breath. mm, Always ask questions slowly. Don't shout, because shouting at times makes people think that there is something so bad that has happened, and maybe a person is so worse. Even the person who is in danger that you've got, because most of the emergencies, let's say, the emergencies we get at home is intoxication, uh, dizziness because of person maybe is on drugs and he has overdosed and is passed out. Uh, accidents, accidents, people who take alcohol and they overdo. You see, all these are real life situations. Sometimes you may see a person has inhaled a gas at home, and this gas has gone through the system, and this person is not okay. Now, you take a deep breath, look at the person, reassure the person that you are okay. Reassure that person you are okay. This is the first step when you reach a site and you see this is something very serious. Be calm, think straight, take a deep breath, and always take time before you respond to questions or when you are talking to others. And then There are some things that are very important. There are some things that are very important, like emergency situations. Which are the signs that you may look at, and then you know this one is an emergency. Check if the person is unconscious. Is the person breathing normally? By breathing normally, I mean there are some things called paradoxical breathing, whereby when you breathe, instead you are of when you breathe in, instead of your belly going up, it goes down. You're breathing while your belly is going down. There is breathing so fast, and there is something called kusmos. Kusmol breathing. Kusmos breathing means a person is breathing so fast and is not finishing the cycle of breathing. So those are the things you should look at. Look at the surrounding area. Look at the surrounding area. Is there blood? Hmm? Is this person showing signs of chest pain? Sometimes when people have chest pain, you'll see them holding their chest tight. Is there a sign of chest pain? You get it? These are the signs when you get to a place. The first step we've said is you be calm, stay calm, and take the necessary things straight. But now, after that, check at the emergency signs. Unconsciousness, breathing. Is this person breathing normally? Things like what I've said, paradoxical breathing. And then there is breathing so fast. But you know that there is a difference between breathing so fast and breathing and you are not finishing the cycle. Hmm? Those are things you should capture. Is there some severe bleeding around? Is there any sign of 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 blood? You see, those are things you should look at and first do what? Sorry. Yes, and respond fast. Seizures for epileptic people. For epileptic people, you should look at seizures. Is there froth from the mouth? Is there froth from the mouth? And then this person, signs of collapse. Look at, maybe he was carrying something, he slid and he collapsed. Check out these signs, they are very important. If yes, and you are not a medical practitioner or so, and there's things you look at like the palms, and then you see that these palms are blue, you you have emergency numbers you can call or shout for help. Always, always, always when you are at the site, don't look at the symptom, don't look at the symptom and guess a diagnosis. Don't say that I already know this is what is usually happens. He's on panic attack. No, don't guess a diagnosis. I think it is malaria because the fever is high. No, don't guess a diagnosis. It's very wrong. It may lead you to give wrong drugs or wrong notions to people and delay the time to help this person who you found on an accident scene. And remember, when you get to, let's give you an example, like when you get to an accident scene, a real accident scene, and you see people panicking, removing everyone from everywhere, chase those people away. Chase those people away because, just as I have said, someone may be injured in an accident. And then the way you push that person, because maybe the bones are broken, they may in turn damage nerves further. It is very important when you get to a real life situation as someone has fallen down, maybe epileptic, and you're seeing some sign of of blood, and you don't have any medical information on how to handle this person. You call emergency response team, because taking a person from an emergency scene is not just picking that person and rushing to a hospital. No, the more you reach at an accident scene and you pile there, as you are working on the people who are injured, first, you are losing oxygen. Second, you are destroying more, you're making more damages to those people. I've said many people who are at hospitals and that they are paraplegics, quadriplegics using the wheelchairs. These people, most of the cases were damages at the accident scene, not after the accident. Because by retrieving this person well, you put this person in a good stretcher and then you go to a hospital. It may be repaired and this person may walk away again. Yes, we said we don't guess a diagnosis. We don't say that uh, just take this medicine. You see, you are sweating, just calm down and see the person is unresponsive. No, wrong assumption can delay in life-saving care. By the time the person comes to a hospital to be helped, this person is already damaged. Do only the basics that you know. Do only the basics that you can for safe actions. Hmm? If trained, you know the normal things that you do when we get to an accident and there is bleeding. Apply pressure on the bleeding so that you can stop bleeding. You know, bleeding kills so fast. Place unconscious but breathing person on the side. On the side. On the side means this person to sleep on the left side so that one leg lies on the other end and then the person looks on his or her left so that if there is any aspirations they can come out and this person can breathe well. You get, help sit or lie comfortably. It's very important. Help sit or lie comfortably. Ask simple questions when you are there. Say the first step, you be calm, no more issues. You ask what happened. This is, you've got to the scene and you're seeing everyone is panicking. There is no one who is there helping anyone. So you get there and ask what happened. What where does it hurt? If someone is really shouting and you're seeing no blood, when did it start? You get it? When did it start? When did this start? It is very important to note all this. Hmm? It is very important to, just a minute. It's very important to note. Do you have any illnesses or allergies? Because someone may be having, may be asthmatic, and being asthmatic may lead to what? Asphyxia. It may lead to this person not responding. Maybe at times this person may not be okay. Lose oxygen. You get it? Are you on any medication? Very important. Are you on any medication? Maybe inhalers. You get it? Anti-diabetic drugs, antihypertensives. This may help you to know if this person has taken a lot of medication that has led to hypertension. You see? Now we continue and say this. These questions may help even a doctor sometimes. They may help even a doctor to work on them on the patient when you get to the hospital, because maybe you may reach the hospital when the patient is unconscious. You see? So you ask, maybe the people that are panicking around know a history around this person. Mm. You don't go at an accident scene, a person whereby a person is unconscious, and then you start giving random medication. Just try as we wait. You give painkillers, and this person has passed out. Some people get to an accident situation. Mostly, I've seen people that are coming to hospitals and they are epileptic and they have been given a lot of stuff like milk. They have been given some powders. You even don't understand some of the things that this person has been given. So it's important to do not give anything or antibiotics that someone took some months, some weeks ago, and they are still there. Mhm. So you check this out: herbal or traditional remedies. Herbal or traditional remedies. I'm not against traditional remedies, but we in times of there is something called contemporary medicine that are proven over time and they are used alongside uh, the mainline medicine. But you see, these medicine are proved over time. But there are some things that you don't know when it comes to herbal medicine. You don't offer. Let the people in hospitals, the lab technicians, the doctors to do their work. In when it is life threatening, it is important to let the people at the hospital to do their work. And then you think of, now you've tried, you've asked questions, you've been calm, you're trying to find out what happened, you have got your answer. You go and seek professional help early. And by professional help, what does it mean? It means you rush to the nearest clinic, the hospital. Maybe some people have numbers to an ambulance somewhere, and ask a trained person nearby if it's going also to check on what is happening on to that person. It's very important to note that, to check on what is happening, because nowadays our healthcare workers are all over, and you may be one or two may be around your vicinity. It's very important to shout for help and call for help. Hmm? Those are things we call the first aids. Aids, it's important. First aid is very important. Observe and report changes. Observe and report changes. There are so many things that we do to make uh, some things to maintain life when it's a situation of life-threatening situation. So when you observe these changes and you see there are some things that are not working out, there are some things that you as a normal person cannot work out, you call for help. Call for help, which is very important. Always think straight. Always think straight. We have gone through several points, and these points are very important from the beginning. We still have several left, but we're taking this break and then we'll come back again. We have, when you get the scene, stay calm. But two is check if there is emergency signs around the person you've met. Then we're going to do not guess a diagnosis. That one we've said you do not guess a diagnosis, and it's very important you listen to that, because you may give wrong medicine to this person. Do only basics for safe actions. Yeah. Basics, we have said you apply pressure if there is bleeding. Place unconscious but breathing person on the side. That's what we have said. Place unconscious but breathing person on the side. If it is a multitude of people and you don't know what's happening, you ask simple questions to help you maneuver when people have panic around. Mm. And then you do what? You do not give random medication. So you next you do what? Seek professional help. Now that's 20 minutes of helping this person. We will continue with this after some time, an hour or so. We take a break, we come back. Good time.